I will tell you in the next minutes what will do and what we have already done in Salzburg to make digitalization or how we can use digitalization in routine care. I think this is the most important thing because during the last years we talked a lot of about digitalization. We talk about digitalization when we meant communication. Helene already told us about the initiatives of ELGA to build up a national electronic health record. At the moment, we talk about web portals and eHealth platforms, also on a regional levels and also on the level of the hospitals. And we also talk about security. This is one a big topic when we talk about digitalization is this communication part. But also when we talk about digitalization in healthcare, we mean the topic collaboration, because digitalization gives us the tools to help physicians work better together and also to share information and to make information more accessible for their routine usage and for their routine care. We talk about disease management programs. We talk about telemedicine, we talk about home monitoring, and we also talk about apps. I think Jan Sedmik already presented a lot of apps what has been or have been developed in Salzburg. These apps are very useful to help the physician in collaboration, helps the patients in collaboration with the physician, and so on. But the third field, and this is quite a new field, is when we talk about digitalization, we also talk about data. During the last 10 years, this topic came up and in priority. When we talk about data, we don't have to talk about the data, what we meant in routine care, for example, PDF reports or scanned papers. We have to talk about structured data. We have to talk about technologies. We have to talk about billing and reimbursement data. We have to talk about registers and data platform, and also we have to talk about AI, because I think it's my personal opinion, AI will become a real big game changer in healthcare systems. But to have these new technologies available, we have to have our good data, because we have to train these models, and without the data, it's not possible. In my opinion, it's very important when we talk about digitalization in healthcare in Salzburg, especially. We don't have to take only one organization into the focus. We have also a focus on the patient pathways, because the patients move from one healthcare professional to another, moves from the hospital to the general practitioner, moves from the general practitioner to nursing homes, and so on and so on and so on. So we have always when we talk about digitalization, we have to have in mind that we have to focus on the patient pathways and don't look on isolated data platforms or isolated IT systems. When we have a look on patient pathways, we have to have different perspectives. We have the patient perspective, we have the healthcare providers perspective, we have also the perspective of researchers, innovation, and system governance, and we have also perspective of citizens and the healthcare system itself. So we have to put all these things together when we talk about the digitalization and the new digital health care landscape in Salzburg. So we started several years ago with a lot of projects in Salzburg, which focus on patient pathways, but were only on a pilot status and in a very closed, and they were only available for a closed user group, let me say in that words. We have developed services for patients. For example, the healthcare hotline 4050 direct lane, where we want to motivate people to call a telemedicine healthcare center in Austria before to come to the hospital, or to come to the hospital. We have also developed teleconsultation services for discharged patients for the hospital, which I think will give a good benefit for the health care professionals, also for the patients. We have also put a lot of efforts in the rollout and in the in ELGA and the e-medication, e-vaccination projects, and we have also tried to develop projects for stroke, for dermatologies, for mobile mount management, and one of the latest innovation projects was we want to try a medical messenger for the healthcare systems. All these projects were, in my opinion, too isolated, and they used too many different technologies, and were not very well integrated in our healthcare system, and also in the IT infrastructure of the healthcare professionals. So we have learned a lot during the last years. We have learned that we have to connect all healthcare professionals and facilities to ELGA. Helene also already told us that there is a big effort also initiated from the healthcare reform to do this within the next 2 years. Especially in Salzburg, it's very important to have all the laboratories and the radiologists on board on the ELGA platform. And also we have to consider the senders and the recipients' perspectives, because when we talk about ELGA, when we talk about data exchange, there are different views. When we have the sender's view, and also we have the recipients' perspectives. For example, we put a lot of discharge letters on the ELGA platform, but nobody or only less physicians are willing or are able to read these reports, and this is a problem because we have a lot of data. Helene already told us the big numbers, but when we look at the numbers who are using this data, they are not so high. We have to focus on interoperability and usability. This was also lessons learned from this project. What are shown on these slides, because all these different projects have to work together. Yes, because when we have isolated data platforms, when we have isolated data silos, they are not connected. We cannot focus on patient pathways. We only have isolated views on the data, and this is not good. Also, the problem of data completeness, it's not only a problem from Salzburg, it's a general problem in Austria that just there are a lot of key players in the healthcare system missing, for example, laboratories. But when we talk about digitalization and a new digital landscape in Salzburg, I think we have also talked about rethinking processes. I found this equation in the web that told us old organization plus new technology could be an expansive old organization. And some of these projects, what are shown on this slide, showed us this, because without transforming the organization, without transforming the processes, you may double your efforts, because you have to have your old process with the old technologies, and you have the new processes with the new technologies, and this could be a problem. So when we think about digitalization in Salzburg, when we talk about a new digitalization landscape in Salzburg, we have to rethink processes. We have to to rethink the way the healthcare professionals work together. We have to rethink the process, how we include patients in their disease management, and how we communicate with the patients. And to put all these things together, what we found out is we need an overall coordination, because there are so many aspects to be considered when we talk about digitalization. So we need one organization who keep all the things together, and who also make a roadmap, and who is also responsible for prioritization and so on. So this is a short overview of our mission and the fields of actions, what we have planned, or what we are planning for the next years. As you can see, at the moment we have an eHealth infrastructure. We have our ELGA and our public health informatics infrastructure in Austria. We have it also in Salzburg. We have an eHealth platform in Salzburg. But when we talk about digitalization today, we talk about it's very technology driven. We talk about server, we talk about documents, we talk about standardization. But what we have to do, we have to move to a point where we talk about eHealth services. We have to talk about eHealth services. We have to we want to talk about the process and data driven approach when we develop new services in Salzburg. But on this way, we have to have several milestones. Let me say, I don't want to have a timeline here, but what we are planning for the next years, the first step is we have to provide ELGA connectivity and connectivity to the public telematic infrastructure for all healthcare providers and healthcare facilities in Salzburg, because with ELGA connectivity you get also the network connectivity. You can focus on security aspects. You have all the organization around you to use digitalization in your organization. When we have this basic infrastructure, we have to design and create new digital solutions, new digital service. We have to rethink processes, and we also want to have a kind of process innovation in Salzburg, because I think Salzburg, we have a good mixture. We have the hospitals, we have the university, we have the researchers, and we have the healthcare facilities on the countryside. And so we have to rethink all of these processes, how these healthcare providers work together now, and how they will work together in future when they use digital tools. On this way, we have to talk about integration in IT systems. We have to talk about migration from an old system to a new system, and we also have to talk about usability, because without a good integration in IT systems and a high level of usability, nobody wants to use these tools, and so digitalization will not bring this benefits what we expect. And last but not least, we have to talk about financial, legal, security, and data protection aspects as well, when we want to achieve the goal to talk about and want to design eHealth and telemedicine service for Salzburg during the next years. But what this picture also shows, in my opinion, it's important to start with the basic infrastructure first, because if you want to build cities, you have to build roads before. Then we have to talk about the processes. We have to talk about the integration, and after that, if these aspects became clear, we have to talk about security, financial, and legal aspects, because a good systems will also be financed, and I'm sure that all the legal and the security concerns can be discussed. Helene also already told us about the national eHealth strategy. I don't want to go into details on that slide. I just highlighted 5 out of 8 goals, which are also very important for Salzburg. The first goal, enabling digital access to healthcare systems, is what we also see in our strategy on the first step. We want to give digital access to all our healthcare facilities and healthcare providers. We want to create telehealth and prevention and care solutions. We have to look what will happen on the national level, what telehealth and telemedicine services will be provided on the national levels, and then we can focus on how we can use these services on the regional levels. Maybe we have to adapt it because a telemedicine solution in Vienna, for example, on the urban area will look is not comparable to a telemedicine solution maybe in Salzburg or in Tyrol, where we have an urban area and broad a countryside where we have to bring all these services to the countrysides and to the regions which are not very close to hospitals and university hospitals and so on. We will also strengthen in Salzburg on the secondary use of health data. Helene also mentioned the importance of the European health data space. I think we have a lot of good institutions in Salzburg who already have a lot of experience in in working with health data and analyzing the data and make this data available to design new services. We also make innovation accessible because we have a lot of institutions who have already designed nice eHealth apps and solutions, and we want also help them to bring these institutions with the apps on a broader field, and to help them to be used also on the in the regular Versorgung, in the regular use. And point 8, we also want to strengthen digital skills, because without having digital skills, you're not able to use digital tools in the right way. And I think this is also very, very important also for us in Salzburg. So how
Alexander,
yes?
May I jump in here? We are a bit over time already. Can you maybe close soon?
Yes. So I can't see you. Just for topics for the future, where we want to focus on for the future, we want to focus on from a patient perspective, we want to focus on a single point of entry. From the healthcare provider's perspective, we want to create new services, new digital solutions for Salzburg. We also want to support digital pathways from the healthcare system perspective, and also from the perspective of researchers in innovations. We also want to help you and the research organization Salzburg to bring their ideas and bring their products to routine care. Thank you very much.